A late summer surge of measles cases has health officials concerned.
In an update this week, the Minnesota Department of Health says there are now 42 cases statewide, especially affecting children.
Callan Gray joins us with how pediatricians are working to keep kids safe.
This is a really contagious virus that stays in the air for 2 hours after an affected person leaves the room. The message from physicians is to get vaccinated. Any child who is 12 months or older can get the measles, mumps, rubella vaccine as cases climb at Children's Minnesota hospitals and clinics.
We've seen a lot of cases.
Measles patients are coming in with both early symptoms, a fever, runny nose, and red eyes, and the telltale rash.
I would say we are very concerned.
Pediatric nurse practitioner Mariam Mohammed says they have protocols in place to minimize contact.
Whenever any patient shows up, we do ask them if they have cough, fever, runny nose, they've been in contact with somebody that has measles. And if any of those things are positive, then they get roomed right away into an isolated room.
And the Health Systems Infection Prevention Department works with MDH.
We ask the healthcare providers to notify us as soon as they suspect measles.
Minnesota Department of Health epidemiologist and medical director Ruth Linfield says there are now 42 cases statewide associated with this outbreak that started in May. Cases really ticking up at the end of July.
It is really contagious.
All but one of the cases are among those 19 years old and younger. More than half are younger than 5.
Spread in the daycare setting and in school settings and other community settings.
Linfield says they are tracking exposures and alerting families with guidance if they've been around someone with measles.
We do have a small window where we can vaccinate close contacts if someone has had exposure, and if they can be vaccinated within 3 days, it really can decrease the risk of their getting sick.
The illness can be severe, especially for infants too young to get vaccinated, pregnant people, and those who are immunocompromised.
From an ear infection and pneumonia to encephalitis, which is a brain swelling and death in some cases. And it's a viral illness, so there's no treatment.
Urging those who can to get vaccinated. The first vaccine dose is usually given when a child is 12 to 15 months old. The second dose follows when they're 4 to 6 years old, but it can be given sooner. MDH says it is recommending to people in communities where the virus is circulating to get the second shot as soon as a month after the first. Kevin?
Okay, Callan, thank you.